C-section versus vaginal birth, what you need to know. Hi everyone, welcome back to Wellness Wonders. We're diving into a topic that many expectant parents wrestle with, the choice between a C-section and a vaginal birth. If you're preparing for birth or just curious about the differences, benefits, and risks, this video is for you. When it comes to childbirth, there are two primary options: vaginal birth, which is the traditional method of delivering a baby through the birth canal, and a C-section, or cesarean section, which is a surgical procedure where the baby is delivered through an incision in the abdomen and uterus. Both have their benefits, risks, and ideal circumstances. Let's explore these in more detail. Benefits of vaginal birth. 1. Shorter recovery time. Vaginal birth typically requires a shorter hospital stay and allows for a quicker return to normal activities. 2. Lower risk of surgical complications. There's no need for abdominal surgery, which reduces the risk of complications like infections, blood clots, or surgical injuries. 3. Beneficial for the baby. The baby may benefit from exposure to beneficial bacteria in the birth canal, which can help boost their immune system. 4. Lower risk of respiratory issues for the baby. Babies born vaginally are less likely to experience breathing problems because the process helps clear fluid from their lungs. Risks of vaginal birth. 1. Tearing and episiotomy. The process can lead to tearing of the perineum, and some cases require an episiotomy, a small cut to help deliver the baby. 2. Longer labor. Labor can be lengthy and exhausting, especially for first-time moms. 3. Potential for emergency C-section. If complications arise, an emergency C-section may be necessary. 4. Pelvic floor issues. Some women may experience weakened pelvic floor muscles post-delivery, which could lead to issues like urinary incontinence. Benefits of C-section. 1. Planned and predictable. A scheduled C-section can be convenient for parents and doctors, allowing them to choose a specific delivery date. 2. Reduced risk of birth trauma. In some cases, it can lower the risk of birth trauma for the baby, especially if the baby is in a breech position or there are other complications. 3. Helpful in certain medical situations. It's often recommended for women with certain health conditions, such as placenta previa, heart issues, or a previous C-section. 4. Less risk of perineal damage. Since the baby doesn't pass through the birth canal, there is no risk of tearing. Risks of C-section. 1. Recovery time. C-sections involve major surgery, which means a longer recovery period and a more extended hospital stay. 2. Increased risk of surgical complications. There are risks associated with any surgery, such as infection, blood clots, or anesthesia complications. 3. Breathing issues for the baby. Babies delivered via C-section may have a higher likelihood of experiencing respiratory distress. 4th, potential impact on future pregnancies. There may be a higher risk of complications in future pregnancies like uterine rupture or placenta previa. When is a C-section necessary? It's important to note that sometimes a C-section isn't a choice but a medical necessity. Conditions like placenta previa, when the placenta covers the cervix; fetal distress and breech position, baby is feet first; multiple births, twins, triplets, etc. A history of a previous C-section are some of the situations where a C-section might be recommended to ensure the safety of both mother and baby. How to decide what's right for you. Deciding between a C-section and vaginal birth isn't always straightforward, and what's right for one person may not be right for another. It's crucial to have open discussions with your healthcare provider about your birth plan, your preferences, and any medical conditions that could influence your decision. Tips for recovery for both. Whichever birth method you choose, recovery is a big part of the journey. Here are some tips. For vaginal birth, focus on pelvic floor exercises, take sitz baths for perineal healing, and don't hesitate to ask for help if needed. For C-section, keep the incision clean and dry, avoid lifting heavy objects, and gently move around to aid recovery and prevent blood clots. Every birth is unique, and at the end of the day, the goal is a healthy mom and baby. Both C-sections and vaginal births have their pros and cons, and understanding these can help you make an informed choice. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to the channel for more content like this. If you've experienced either a C-section or vaginal birth, feel free to share your story in the comments below. Let's support each other on this journey.